find Dr. Tucker now. Let me WhatsApp him. Last time I checked, he was eating, so. Oh, there he is. What do I do? There. Ini ya? Ini kan? Yep. Is that not? Okay. Not this one, but this one. Did you get it, Dr. Tucker? Oh, there you are.
Hello. Hi there.
Hi. Yeah,
How are you? Looking for
Good.
me.
Okay.
I was right here.
Let me put on my.
Where's it? All good?
All right. I can't hear you
There's
yet.
a delay.
Give me a minute. Wait, my earpiece is not. Just don't use it. Okay, I guess I don't have to use it. I can hear you.
Can you hear me?
Yes, I can hear you. Can you hear me? All right. So, hi again.
Hello.
How was dinner?
I haven't had dinner yet.
No? Oh.
No, that was an old photo.
Okay, I was coming. And I invited Ginny to come with me.
Someday we'll do that. I think that was my birthday or Christmas maybe.
It was
Just
amazing.
something to make it home.
Okay, so I guess we have people join us already, so we can start.
Good.
Good evening again, Dr. Tucker. I don't think you need any introductions. My favorite doctor. And today we're gonna talk about dementia.
Yeah. Do you know anyone
Yeah.
who's had dementia?
Kind of, yes.
It's a horrible, horrible condition.
It degrades you.
I think in a very technical way. I mean, it's sort of like you have an operating system and we always want, that new update. But in this case, you get the old version and it just keeps slowing down. Yeah. Loss of memory. Where did I put those photos? Yeah, no. Some people, think of it as, there's type 1 diabetes, childhood diabetes, insulin dependent and autoimmune disease. And then there's the type 2 adult diabetes we talk about all the time because it's so problematic because of sugar and insulin. Some people talk about dementia as diabetes type 3, that it's, because it's all related to the same chronic conditions that you're so concerned about that, impact my work as a cancer doctor, but it's all broadly the same, what people call root cause. It's the same root cause. Yeah.
Yeah, so I guess I have my very close person is going through dementia, and I'm watching her, and it's like you said, it's very very sad, and to me, it's quite degrading from who she was to what she is right now, and got me thinking. That's when I said, "Come on, let's talk about dementia, Dr. Thacker." It's something I need to know, and I'm sure a lot of people wants to know. And I know that okay, this is statistic, like two more women got dementia than men. True?
I don't, if you just looked it up, it's probably true. It's not a statistic that I keep on the top of my
Yeah,
head, but
yeah, I guess
it's,
I did look it up.
yeah. But that also might be because women live longer than men. So one of the big risk factors for dementia is also going to be age and aging. And women live significantly longer than men, which on the surface is, we all want to live longer, but we want to live well at the same time. So that might be part of it also. Yeah.
Okay. And I was reading, trying to be a little bit smarter.
Hmm.
So dementia is like the end of it. Yeah, it's it's a lot of things. Yeah. So
Right. It's a very broad description for permanent memory loss, cognitive decline, and overall decreased cognitive function. And there are subtypes. A lot of people use the word, the disease, Alzheimer's disease, as synonymous, equal to dementia. But there are different kinds of dementia. The most common kind is actually more of the what we would call vascular dementia, which is the accumulation of a lot of very small strokes. I think a lot of people we know have an idea about that a stroke is loss of blood flow to the brain, and it might be sudden onset, and it's the equivalent of a heart attack in the brain. It's an area of really important tissue that is suddenly just gasping for air.
pop, pop, pop,
But
pop.
that's a better description. Exactly, because the one where the big heart attack or the sudden stroke in the botanical gardens is sort of a sudden big event, or seems like it, but it's actually the accumulation of the pop, 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 because you can get a tiny little stroke from high blood pressure and inflammatory disease and not even notice it. You could see it on an MRI, and it'll be not even a millimeter. It's like the head of a pin. But if you start getting one here and one there and one here and one here, at a certain time for some people, there's this overlap where this little area of cell death, like little circles, they're all independent, and then one spot, and we call that a watershed spot. It's sort of, it's a like a puzzle where it's the one piece that connects all the other pieces. And that's an area that might be responsible for language or memory or how to kick a soccer ball, or why would I even want to kick the football in the first place? Yeah. Same is true for heart disease. It's a little bit here, a little bit there, a little bit. And then suddenly one more little thing adds up, and then it's a big thing. Yeah. But there are other types of of dementia. There's the Alzheimer's type. Some people have heard more and more about Lewy body disease or inclusion body, things that are in the movies. Dementia that can go with, just a lot of neurological conditions that are, yeah, Parkinson's, there's a lot of these different causes. And I think for somebody listening to us tonight, we should make a distinction. There are those kinds of diseases and dementias that strike really early, like people who get dementia at 60, and you really wouldn't think about it, that, gosh, in 10 years, I'm gonna, not remember who I am or why I'm doing things. We think of dementia as 85, 90, maybe late 70s. I want to take my dad's keys away from him or something like that. But good enough that he's great with the grandkids and this and that, but just at sunset might not remember the way home. There's memory loss and progressive dementia, which is very different than when I take a family history and somebody says, my auntie got, Alzheimer's at 60 and my grandmother had dementia at 70. And there are a lot of people who die very old with very bad memories.
Mm-hmm.
And it's very different than people who get institutionalized into a nursing home or skilled nursing facility at 66. And so when you look at your own family, if you're listening to us tonight, what I think we're going to be talking about for the next half hour is a strategy to prevent that. And some people, if you come from that strong family history where you think it's in the cards, let me tell you, it isn't. DNA is never destiny. No,
It's not
DNA is not destiny. No, I mean, there's a genetic component. There's, if your dad's 6'2", you're probably going to be tall. There's, there are genetic components, but DNA is not destiny. My dad was 6'1", and, I'm definitely, me. I'm 5'8" with good shoes. So, but when you think about the kind that are more risky from genetics and the kind that are more broadly lifestyle at risk, either way, you want to avoid something that might contribute to disease. And what would that thing that you want to avoid be?
I know.
You say it.
I know.
You tell it. It's sugar.
Sugar. Insulin.
Yeah. Sugar, carbs, insulin, metabolic disease.
Yes.
Whether you're genetically at risk or generically at risk, you got to think about your lifestyle, which means first and foremost what you eat. Yeah,
Yes.
for sure. For
Yes.
sure.
You are what you eat, basically, back down there.
Yes. I'm kind of like salmon abori.
I'll go. I'll join you.
Are you getting questions on your end? Or are they building up?
They're building up, I think. And so, I guess I do read up about whatever I can find in the internet about dementia because something that we're going to talk about it. So
Yeah. No stigma. We can talk about it.
So what is the early signs of all this?
So dementia is very difficult to diagnose.
I mean,
I think, but I would say in people we know, in our own families and in my medical practice, it's really common to have somebody come in and say, I'm really worried about my memory. That I think I'm losing my mind, I don't remember things. And as a general rule, and there will be obvious exceptions, and this is just a broad idea, people who, for the most part, are worried about their memory don't have dementia.
Oh.
People who deny that there's any problem with their memory, and when their family members bring them in, that's more of a concern. Okay. But for a lot of people who have memory problems and dementia, in the early stages, they learn how to cover it up. That there's certain excuse making, change in behaviors that make it easy to overlook. I think that's definitely something that happens. But there aren't a whole lot of, doctors like the phrase, there are signs and there are symptoms. Signs would be something I observe, and the symptoms are something that the patient tells me. And everybody tells me, that their memory's not good. Everyone tells me my memory's not good. But it's all, we're pretty good, and I think we hold ourselves to a high bar. But it's when the spouse comes in or a child comes in And there are formal and informal ways to assess. I might just start asking, in conversation, building trust, be sort of like, oh yeah, hey Yanti, yeah, this is gonna sound silly, but is it 2021? Is it still June? And and I'll be thinking, yeah, I know it's June, but I need to make sure you know it's June. And people, and the other thing is sometimes we can just be, as doctor patient, hanging out and like, oh my God, I so remember Y2K. Everyone was freaking out, New Year's Eve 1999. And then, where were you on New Year's Eve 1999? And they're like, well, I don't like New Year's Eve. And they don't answer the question.
Okay.
They sort of change the topic.
Yeah.
And so there's this defensiveness, and that would be a sign. I would look at that and say, I'm a little concerned. Let me
Okay.
throw in, there's another word that people
Mm-hmm.
sometimes think are synonyms, and it's called delirium. You could be
Okay.
delirious. You could be so excited and delirious you don't quite remember. But delirium is temporary. That happens to patients in the hospital, that they've gotten anesthesia, heavy drugs, and painkillers. They had surgery on Monday, and they don't know that it's Wednesday because there's
Yeah.
no time cue. That's temporary. And people don't really fight you when you try to bring reality into it. And that's the thing. It's that fight in their brain is the sign.
Yeah.
Yeah,
The denial. Yeah.
exactly. And it's not denial like it's confrontational,
Okay.
but it's not an intentional denial for sure.
So the more I read into it, I also stumbled, of course, upon like how this is considered to be a type 3 diabetes, and also that the brain is actually fueled by ketones,
Sure.
happily by ketones, not carbs.
Right. Correct.
So does that actually really really help in your lifestyle, your diet, being on the low carbs, being a non sugar diet?
Absolutely.
So
Absolutely. And depending where people are in the spectrum of memory loss, particularly in the early stages, it's very clear that diet and lifestyle, that low carb, as you like, anti-sugar, absolutely makes an impact on cognition, on the domains of cognition, your memory, your vocabulary, long-term memory, numerical, counting, and all of and the skills, your ability to do a puzzle, or the complex. I'll tell you, a good test is like, and I know everyone does Venmo, and they're, they don't, people don't have checkbooks so much anymore. But the idea of balancing your checkbook is something that you can do. And so if you're in the early stages of memory loss, that you've got chronic disease, adult diabetes, heart disease, and your high blood pressure, changing your diet, becoming low carb, and even more ideally keto, it has actually been studied, and in not in everyone, but in a large group of people, it reduces or delays development of cognitive decline. So there's a whole Alzheimer's clinic at UCLA where I trained that's totally focused on preventing, delaying, and reversing Alzheimer's through
so
diet and
it's
lifestyle.
reversible, yeah, not only
I
delaying
I I think
in
it's
early
for some
stages.
for some people. If we go back to what I said 10 minutes ago, if you come from the family where 50% of the people get Alzheimer's at 50, this is a very different version of memory decline than somebody who gets it at 75. And it's not that the diet and lifestyle aren't helpful, they just may not be as impactful as it will be in the diet and lifestyle versions. Yeah.
Yeah, so like the last time we met, when you read my lab report, you was
Mm-hmm.
like, "Oh, I can easily give you 50 more years to your life."
Oh, easily, easily.
Yeah,
Yeah.
but I want to make sure that when I am 100, I'm still able to walk, to dance,
Right.
to feed myself. Although
Yeah.
there might be
Yeah.
help, but still. I want
I
I
think so.
want
I'm
I
with you.
still want to have my dignity.
You want to be autonomous. You want to make your own decisions. Definitely feeding. Um, uh, what's the behavior? What's the polite way? Personal hygiene, personal care. I want all of that, and we all want all of that. And the key to maintaining, there's a couple of things. So we're talking about dementia, and you have to maintain your thought process, which is initiation. I wanna go to the shower. you know. Second is I need to be able to walk to the shower. I need to be able to balance on the slippery floor of the shower, and I need to be able to get out and towel off, right? And so there's quite a few things in there. Cognition is one of them. Like, how do I do, I want to do it. There's also the physical ability. Forget about muscles. It's sort of like the brain, the part of the brain that says, this is how I move the towel back and forth kind of thing. To dry off, or to accept, here's a good sign around dementia, sort of like, hey, grandpa, you didn't dry your hair. And it's cold outside. And they don't remember or think about how they used to yell at you for walking outside as a kid with wet hair. But all of the diet and lifestyle piece is going to help us get to that point so that you and I are, 100 plus and still sharp enough. There are other things that go with it too. The diet is probably number one, and it's definitely low carb. And I probably at that age, it's a combination of low carb and low calorie.
Yeah.
So you don't want to really just pack it on. Because you want the ketones to do their job. You don't need to keep taking in as much overall energy, but you need concentrated energy. You need good, healthy fats. You need adequate protein. You don't need the carbs.
Yeah.
But you know what else you need to really stay on top of everything? Uh, to keep dementia away? You need
Exercise.
friends.
Oh, of course.
Yeah, you need a lot of friends. You need a social circle. It's really important,
Yes.
which means if you're listening to us, you have to get your friends to also be low carb, because then everyone's going to be sharp. And what you'll have is you have, what do you call it? The anti-sugar club,
Yes.
right?
Anti-sugar sugar club.
The anti-sugar club, you need like the Mahjong anti-sugar club, or the Singapore Island Country Club tennis club anti-sugar club. Because there's certain activities like bridge and Mahjong and tennis that bring people together, but also require you to think.
Yes.
And
Yes.
that social interaction, I would say, as we age, is number two after the dietary choice.
Yeah.
Yeah. We're social animals, and
We are.
being alone is incredibly unhealthy.
Yeah.
Yeah.
This social distancing is really hard on a lot of people.
Well, you and I we can go to dinner. We can go to
Yeah.
lunch, but it'll just be the two of us. Yeah.
What happened to Asa and Iwan? Get
Ewan
another
and
table.
Asa get along fine. They'll be
Get
happy.
another table.
You, yes, at another restaurant. Yes, we can alternate between steakhouse, fish house, sushi, all of our low carb secret hideaways.
Yes. There was a question about actually, it's my question. Does menopause affect your brain being broken?
Well, I think that that's an incredibly controversial question. And menopause is a natural state. So that is something that has for thousands of years occurred to women. The impact of estrogen on the brain.
Mm.
Now, I, women live longer than men. So
So you told me.
what? Why? So I gave you a fact. That's just a truism. What is the relationship of estrogen to longevity? What is, um, I mean, I don't think it's any surprise to know that women are smarter than men. So there are certain
Oh,
choices that can be made.
no wonder I love you.
Men make horrible decisions. Horrible decisions. We all can make bad decisions, but come on, I'm not going to blame hormones either way. But I think that I don't think it's necessarily menopause and the physical lack of estrogen as much as the change of life and any individual's ability to cope with change. And so it is a change that everyone knows. And depending upon where you are, maybe more in the combination of your emotional life and your biological life, maybe your social and financial, how you have almost been imprinted to see how the women in your family transition through different phases. Because, I mean, for women, they're sort of like you're a little girl and you transition into someone who has a period every month. And then you transition into someone who's now pregnant and are breastfeeding. And these are these different roles that women transition through that are physical, hormonal, biological. Men transition through different stages or roles and responsibilities, but we don't see our bodies change through those roles. It's a very, we both can become parents, but I didn't have to breastfeed. My body didn't prepare to breastfeed, whether, you do or not. And so I'm going to take a safe answer to say that it's more about the transitioning than the actual hormonal change. And I think that the science data about estrogen and some of the hormone replacement studies have failed to show that it's either harmful or beneficial on cognition, having more or less estrogen after the age of 50. The original idea was that having estrogen improved cognition. And I think that there is information to suggest that. But when, the academic doctors sort of say, we did a study, it was 80,000 women, and we couldn't tell the difference, doesn't mean that there weren't like 10% of women who really felt out of it and 10% were like, let's play chess. Yeah.
Well, I could not play chess, but I'll try
Not
mahjong.
my favorite game. Yeah.
I'll try mahjong. At least you have to play four of you. That's socializing. Huh?
Right.
Chess is
Right.
only one-on-one. It's not
Yep.
a community. So yeah.
Yeah. Not the same.
Yeah.
Not the
I
same.
guess mahjong it is. I'm gonna join the club tomorrow.
Menopause is a good time for anti-sugar club,
Yeah.
right? Yeah.
Yes.
Uh-huh. That's for sure.
Okay, there's a question here from Lydia. She's asking if pre-surgery anesthesia would lead to dementia.
As a general rule, no.
Okay.
Yeah. No. No.
Is
Anesthesia is not the cause of dementia.
Okay, and do you have any recommendations for good brain food?
Healthy fats. So there's two ways to look at it. You could say the brain is amazing and you leave it alone, just don't give it sugar. Then you could ask, all right, I've stopped giving my brain sugar. Can I make my brain better? And the answer is yes. Feed it a lot of healthy fat. So, plenty of omega-3s, lots of salmon and olive oil. I think that the occasional saturated fats, a good steak, every now and again. But again, probably ideally, if you're fortunate, you're lucky, you go the organic, grass-fed, the ideal version. If it's not so often, and every now and again, fine, you can have the corn-fed American, but it's not all the time. But it's healthy fats. It's all healthy fats. That's the key.
And being
Eggs,
happy.
which is to say, don't let stress overwhelm you.
Yeah. Okay. Does learning a new language help with dementia? Lency is asking.
I think everything I've read says learning a language after the age of, as an adult, probably doesn't help.
Oh.
But I'll give you a variation on that does. Because everyone thinks like, here's it. You could go learn a language or learn to play the violin, right? Or learn a new skill. And I'm not sure. I think what happens is people don't commit to the process. That there are elements of our brain that are fixed, hardwired, and while it can be done, it may not keep dementia or provide the benefits that we think it's going to provide. But there is something that does, and that's new experiences. And so traveling, because if I tell you, Janti, let's go learn Russian, okay? I mean, it's like you're gonna dread it. I mean, right? It's not. But if I put you in St. Petersburg for 2 weeks and let you see the sights, and you know what else you get? Smell. Smell helps you learn things. And so travel and new experiences absolutely do help improve memory, cognition, and keep people young. Being forced to do something, and some of the things that you can learn automatically, in a sense, like I may not become a better chess player at this age. I will learn what I can learn. I can always get better, but I'm going to stay in the same bubble. You could force me to learn Russian, and I will have some limited growth, but the amount of growth and the way that the brain breaks its bonds and makes new bonds is completely different when you're traveling, eating, new experiences, new foods, new smells,
The
new
senses. Yeah.
people. Yeah, that's the whole key. Things that are a little more out of your control, more naturalistic. I would even suggest and advocate danger, right?
Adrenaline.
Yeah. Eggs, well, adrenaline cements what you learn.
It's cheap
Uh, the,
thrill.
I think it can be better than that. I don't think it has to be. A cheap thrill works. Yeah. Okay. Yeah. I'll probably regret this, but I'm a sucker for a cheap thrill. But my kids will tell you, as I taught them to ride bikes and ride on the street, and you have to look, especially at driveways. And I remember once they didn't look at something, and I was always taught like hit their hand, not just enough to be like that was hard and you shouldn't have done it, or that was unexpected, but it ties a physical experience to a learning experience. The way that a smell or a food, whether you like it or not, a cheap thrill ties an experience and a knowledge to something that you don't forget. I'm sure you can remember something that your father said to you at a certain time, like it was yesterday, right? And there are certain strong memories, and dementia is the loss of memories. It could be the loss of memory of how to bathe or why to bathe, or it could be the loss of memory of my first bath. And so, or bathing my daughter, or the first time I did a sauna, something, those memories dissipate. But when you have something to anchor it to, whether it's a positive or a negative. No one forgets when they earn their first million. And no one forgets when they lose their first million. God forbid either of those should ever happen to me.
Touch wood,
But
touch wood.
but it's that
Yeah, knock on wood.
idea of learning and the extreme that honestly the cheap thrill. It's a really good phrase. Yeah.
So before I forgot, actually, I had actually taken up knitting.
Ah,
I
that's
took
good.
knitting so my kids ask, "Why are you knitting, mom?" Because they assume knitting to be an old people's kind of a hobby.
Mm-hmm.
It was therapeutic
Yeah.
first, and second, I thought I'll learn it while I still could,
Perfect.
just in case when I do hit 75 and want to knit. Does that work also? I mean, like your body has a muscle memory. Does your brain has that muscle memory too?
Absolutely. But I think what's more important than the knitting at any age is the ambition,
Oh, yeah, I was ambitious.
right? Like it's like, hey, here's a skill, here's a domain I've never done before.
Yeah.
I want to, I don't need to be in the world knitting competition, but I want to be able to say I can make a scarf or a pillow or embroider a belt, something. And it's a skill, and I don't think you forget. It can get rusty, but when you go back to it, then the muscle
It's
memory, it
That's the
falls right back
muscle.
in.
So your brain has that too.
Exactly.
Ah, cool.
Yeah,
All
absolutely.
right. Oh,
Yeah.
you're gonna get some scarf by me at 98.
Why do I have to wait so long?
Because that's when I'm gonna pick it up again once I'm done.
Uh-huh.
Okay, there's a question here. By Mrs. Saturday. Can a 94 years old dementia takes melatonin?
Um, so first thing is, welcome to Seriously Keto Instagram Live. Please don't construe any of tonight's discussion as medical advice.
Yes.
That
This is
said,
this is only if it,
it's an over-the-counter supplement, and I don't see why it would be against, you talk to your doctor and so forth. I can tell you that melatonin is part of the UCLA Alzheimer's reversal program. That program's pretty extensive. It talks about low carb diets and fasting as very useful, and keto and low carb and fasting, all of that on the dietary domain. There's physical activity, strength training, and exercise, but then it starts to go into a lot of supplements, which include melatonin. For the more extreme cases, there are some cases of memory and overall health issues tied to dental health. This
mm,
is a big thing. Um, Really good dental health. And I'm not going to push any. I mean, I love my dentist. My wife loves her dentist. There's a group of dentists in Singapore that are sort of referred to as biological dentists, and they're the kind, on the one hand, who strongly believe, like, take out all your fillings that have mercury, and I'm not going to advocate either way on that. I have some ambivalence about. I think you have to put it all together in the big picture. But I can tell you the UCLA program is very big on dental health. And I would advocate for those of us who don't have dementia to get a high quality electric toothbrush, and actually brush at least once a day, twice a day. But think of it this way: commit to brushing for 2 to 3 whole minutes a day. So it could be 3 times per minute. And because what you want to remove is the sugars that remain on your teeth that feed the bacteria that are unhealthy for inflammation. So it's not as much. It's partially about the mercury for those dental people, but the UCLA program for dementia reversal also includes flossing. They like the really high-end water flossers. I mean, it's literally in the protocol. Um, and there's no one thing. And they look at this list of like, here's all the interventions you can do to help reverse dementia. You don't have to do everything, but if you're a dentist and you've been brushing for 6 minutes a day, and you have dementia, we can't brush you better. Maybe there's another area to work on. But if
But
you haven't
yes,
been caring for doing good dental
dental.
health, yeah, then now is a good time to start for
Yeah.
sure. Check that
One more on your,
box.
yeah.
Mm.
Tiara is asking, is there any type of dancing that best helps to prevent dementia?
I would bet that any kind of dancing helps prevent dementia. You know why? It's the Mahjong rule. You can't dance alone.
Yes.
It's social. The dancing is both so tennis always wins as the single best exercise for longevity because it's got the right amount of physical fitness, but you can't play alone.
Yeah.
And so that I would not underestimate the value of social bonds, and dancing is without question a social sport.
Okay, so there was another article I read about the people today. They're not being individualistic, but they don't have enough touch. It's a society where you don't hug, you don't touch, you don't.
Where we have masks and gloves.
Oh, now became like that. But yes, but even like in America,
Right,
it's not a touch.
right.
It's not a touchy society nowadays.
The
And
anti-touch society.
the so so isn't that like a hormone that you secrete when you actually do give a hug, and it's the
There's two.
touch.
There's a couple of things in there, and I
And
agree with the questioner and your description.
and then wait, one more, go on, a little bit more. And then so when you're a widower, you live alone, your children also don't touch you that much, and does that promotes brain?
So touch requires love and friendship, social. So as we already said, let me be very clear: loneliness kills. Social lives longer. Whether you're social and don't touch, social alone, sitting, we'll go back to the Mahjong table. You don't have to touch anyone, but being together is its own touch.
Gives you a
You can do
happy energy.
better. You can do better with physical touch. And what physical touch represents is your senses. And to put this another way, one way to accelerate dementia is hearing loss or blindness or the inability to touch. So our senses keep us in contact with people, and the loss of any sense of smell or taste. People who lose senses are increasingly at risk for premature death compared to people whose senses remain intact. And so touch, when you do have touch, certainly caring touch, the hormone you're talking about is oxytocin. It's the same love hormone that's widely written about. It's the hormone responsible for milk production and milk letdown and the bonding of mommy and baby with the, almost eye to eye. And a lot has been written about this, and a lot of it is wishful thinking, and a lot of it we just don't understand. But that physical touch not only promotes oxytocin and promotes these beneficial hormones, it also sends away, diminishes, reduces, and banishes all of the negative stress hormones, right? So imagine you're alone, you're 78 years old, living in a nursing home, and you're feeling sorry for yourself, and you're lonely, and and your great niece comes over and hugs you and tells you stories and listens, and you just that positive vibe is like this, California saying, right? But what is it really? It's adrenaline and dopamine and serotonin, and it's hormones that are soothing to your body and your brain that help you sleep at night, as opposed to these hormones that are like, giving you grief, like adrenaline and noradrenaline and cortisol.
Okay, does pet counts? Dogs, cats?
Yeah. Social, right? Care, love. I don't, I personally, I'm allergic to cats. I like cats. I think they're cool. I think cats are
Garfield?
cooler. There's so much. That's not where I was going at all. I
What
was
is the
more like
bus?
predator, carnivore.
Okay.
But I mean, Garfield's funny, but yeah, okay.
Oh, he's so witty.
I'm gonna have to go back and read Garfield. Yeah, okay. I I was just gonna say, I think cats are very cool, but I sneeze. I love my dog, and we've pretty much since, when I met Asa, she had a dog, a bulldog, and he was the first baby. Then we had another bulldog, and now another dog, Lola. I think that the dog definitely provides an advantage. And I mean, emotional support animal. So again, we can be all touchy-feely and talk about the vibe, but it still gets back to the hormones and the stress,
What
the same problem that
what
sugar causes.
what about those introverts people that they just
Introverts are
want
fine.
to be alone? I mean,
I don't
they
think that's true.
they just happy to be by
I don't
themselves.
think I don't think introverts necessarily want to be alone. Introverts could be very happy in a group of people. They don't want to get up and talk to all the people at once. Introverts are not the same as social isolation. They I think that introverts get a bad rap because extroverts,
It's
are
louder.
in a sense they're gonna be louder and say a bunch of stuff, and the introverts could be like, I know that you're wrong, but I don't really feel like speaking up and letting everybody know. I'm
Oh,
gonna go do
that
my own.
sounds like Iwan and me.
It's introverts are cool. I mean, it, I think it's totally fine. I don't think introversion and extroversion don't necessarily relate to dementia or health in any way. Yeah.
Okay. There's a question. What if you don't have friends but are not lonely? That's one. And being social doesn't necessarily mean having a village around you, right? As long as you're
Hmm.
not lonely.
Well, yeah, but
Mm.
being alone and not lonely, I would have to know the person a little bit, in a sense.
I'll send
Yeah,
that person to
it's
you.
hard. Okay. Yeah. Because, I mean, yeah, there's a lot more to it. Mm.
Okay. Slamateli asking, oh, Ellie Slamet. Does taking sleeping pills for a long period of time causes dementia?
It doesn't make you smarter. Yeah.
Yeah.
No, I can't say that there are certain sleeping pills that, um, it's the right way to put it. They don't help your cognition. And getting the sleep with yeah, there, as a general rule, chronic use of, and sleeping pills is a broad category. So I would say like chronic use of benzodiazepines, so Valium and Librium and Xanax and Ativan, they don't They certainly don't prevent dementia and cognitive decline, and they may make it worse.
Oh, okay. What about meditations?
Medications. So,
Meditation.
oh, meditation?
Meditations, yes.
Yeah, meditation. Excellent.
Om.
Perfect. Excellent. Yeah, it's good for you. I mean, on all levels. Um, I don't, if I had early onset dementia, not necessarily early onset, if I was in the early stages of dementia, I wouldn't say the only thing I need to do is meditate. I don't expect that meditation is going to reverse my dementia. But I do think that the ability to use meditation at a young age, through middle life, through at our age, at wherever you are, where you're highly functional, is a very good tool to ward off, chronic disease, as much as exercise and low carb. And, I think you know what I like better than meditation? Same, but slightly different. You've heard the phrase breath work. Have you ever heard people who do breath work?
They just
Yeah.
do
It's like
breathing.
different
Yeah.
breathing techniques,
Yeah,
close
yeah.
your eyes. There's I mean, whatever it is. And meditation, we talk to the monks, we talk to meditators. They're all very different. But what it allows is versions of mindfulness.
Mindfulness. Oh,
To go back
yeah.
to that last question, the ability to be alone is a great skill. But the ability to also be in a crowd is a good skill too. Yeah, I think that's a good way to think of it.
Yeah.
Hmm.
Yeah.
Are
I
you
was,
good being alone?
yeah,
Can you
I'm
be
okay with,
alone? Yeah.
yeah.
For how long? How long?
Oh, I could be alone for days. I don't
And,
mind being, I don't
yeah,
mind. I mean, I don't have any problem with this lockdowns. I don't have to go
yeah.
out. But I do love my people, though. I do love to meet up
I
with
think I think
friends.
alone is a really good way to appreciate the people.
Yeah, I
Yeah,
think so.
yeah, 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 yeah.
I'm not
Hmm.
scared. I'm not scared to be alone.
I
So,
like both.
I guess a balance of them, though. Yes, I'm
Are you
serious.
sure?
I'm serious. She's supposed to be my team. Fran.
Good, good. Hmm.
Yeah, so now I lost track. Okay. Anyways, oh yeah, I was doing a lot of those when I have yoga group of friends,
Uh-huh.
another and they do the sound bath. That is all the senses.
What's a
Yeah.
sound bath?
So you lie down and they have like gongs and trinkets, so they play boom,
Uh-huh.
they do the chimes, they do the bowls. So they create like a musical, an orchestra out of all this.
Ah.
And
How
it's
do you like that?
it's very it's a totally different experience because especially when you lie down and you have all this music just like bathe you.
Uh,
It's interesting. It's interesting
that
because the
sounds so
music.
stressful to me.
No, it doesn't. It doesn't. It doesn't. It doesn't.
I weirdly, you would think might be able to like that would be cool. I think
No,
that
I don't think.
stresses
I
me
don't.
out.
Yeah, that's true. That's true. Not. I guess it
I
may
want to
not be
do
for
it. I want to
everybody.
do it, but I was like, I would need to be prepared for that.
It's
Wow.
yeah. Well, it's I guess you do have to be. I mean, like it's they don't come like gong at you like
You
you
know,
know.
like, yeah.
They'll build it up. It's like an orchestra, but then you just like lie down, and the sound is really very it's quite mystical actually. It's quite it's
I like
interesting.
that. That sounds cool.
It's yeah, I had that experience in Bali once, and
Hmm.
they made like this pyramids kind of a tiki, and they have all sorts of gongs and bowls and all those things.
Gamalong and all of the yeah.
Not really the gamelan thing, but
Uh,
it's a different sound. It's really
huh.
yeah.
We'll have to do that. Have you
Yeah,
had
but
have you done an ice bath?
the oh
Like serious ice bath?
the closest thing I've done in a night with to an ice bath is we were in 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 a winter resort. I go down. I was in a bathtub in a those hot bath. What do you
Yeah.
call that? Jacuzzis. And I go out and I try to sit on the ice. That's the closest I got.
All of those things are really good for health. I mean, going back to the dementia, it's all really good because that's the kind of stuff that also promotes the stem cell regeneration, the autophagy. It creates the new experiences, the travel, the learning. I mean, it sounds, I mean, it's fun and it's challenging and, the sounds. Sometimes I just need quiet more than I need sound. So the new experiences are so good.
I guess
That's
like back
cool.
to what you had said, the experiences of it all.
Yeah.
Does an ice cold foot bath count?
I I've been teaching patients just in the last year. So with, chemotherapy and all the women that I see with breast cancer, um, at least half of them get this numbness and tingling in their fingers and toes from chemo. And it will go away. It's called peripheral neuropathy. It almost always goes away, but it takes a long time. And I recently learned that one method to make your nerves heal faster is a ice bath for feet or
Hmm.
hands. Really, I mean, and I'm talking not cold water. I'm
Ice.
talking ice, cold, like Titanic water kind of ice. And
That
you
goes to
might
the
have to
brain.
practice 1 minute, 2 minutes, 5 minutes. And the theory is the 5 minutes in the ice, your tissues are completely deprived of oxygen. And then when you bring it out back to normal temperature, you get a flood of oxygen and red blood to these tissues, more than you would have under otherwise normal circumstances. So it accelerates healing in that way. Yeah. So I've been telling my patients to do ice baths, really ice cold baths for their feet after chemo, after their treatments, when they're in the recovery stage. But yeah, I think that ice baths are great. Yeah.
Whoa. Okay, I'm gonna
Yeah.
try a toe
Yeah.
bath.
It'll work. See how long you can go. Yeah. Uh-huh.
Okay, there is a question about alcoholic, I think. With
Mm-hmm.
okay, wait, hold on. I'm
Right.
supposed to ask it in a sequence. Do alcoholics such no, does electronics such as phones affect brain health?
Only to the extent that it becomes a distraction. Like when, like an addiction, that you're not, it's just as bad as, it could be a video game, it could be a WhatsApp message, it could be Instagram, it could be LinkedIn, it could be your Bitcoin, whatever it is,
Basically, you're not
it,
present.
you're not social with people who help you stay, avoid dementia, right? Your phone is horrible by itself, but when it's you and I talking to each other, this is the social bond,
That's true.
right?
That's true.
Yes. Yeah. This is dementia prevention. Thank you. Thank you for this tonight.
Okay, any tips to help someone who is in denial about their dementia?
um, don't confront them head on. Um, use empathy, use a team, use family. Um, yeah, I mean, that's really, uh, try to really be as empathetic as possible and put yourself in their shoes and understand why they're responding the way they do, and um, forcing them to accept their circumstances so that you're right and they're wrong isn't going to be a successful strategy.
Yeah. They
Yeah.
don't they, like you said in the beginning, I guess some of them don't even know they're having dementia though.
No, the ones who really don't. That's why the people who frequently come to me and say, I'm really worried. I used to always be,
Yeah.
I grew up, when I grew up, I knew everybody's phone numbers, right? You just had to keep 50 people, 77-digit numbers in your head.
Yeah.
And now it's just like click, 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 and you don't know. And there were certain numbers that you had, but it's just different today. And whether it's electronics, whether you just have to be social and connected, and you can't measure that success by phone numbers and some digital tricks.
I can't even remember
You
my passwords.
should just use like retina thumbprint. That would be
Yeah.
ideal. Yeah.
Can depression lead to dementia?
Yes.
Yes, I think so.
And
Um,
dementia leads to depression.
oh yeah, they do. Yeah, it's one.
Yeah.
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 Does alcohol cause dementia?
Yes. Not not universally. There are certain kinds of brain disease. Some people are more susceptible than others. But it's generally, as a general rule, alcohol for most people, um, is going to have some impact on the brain.
Okay. What do you think of the new FDA approved Alzheimer medication, Adulam?
I
Aduhelm.
have not, I've only read the headlines. I know it's incredibly controversial, that there are a lot of questions about, how you measure success. And there are, because it's not an obvious win. This is not a drug that is going to prevent the disease. And this is not a drug that is going to cure the disease. And I would hold up a mirror and say, Steve, you're a cancer doctor, and you have a lot of medicines that don't prevent cancer and do help people live longer, but they don't cure disease. So that's not the end all be all. But it's also an incredibly expensive drug with a probably at best a marginal gain on average. There might be a rare few people who have, it's like a miracle. And I want the system to be more liberal and approve drugs. I don't need the criteria to be I need safety criteria to be high and benefits to be, they might be marginal, we want more, but maybe we have to get it out to more people that didn't fit the clinical trial. But I also can't have it break the bank. We already have enough problem with cancer care. Yeah. Yeah.
Yeah, so I think if I may say so, the answer would be also go on keto. That's the best medicine.
Yeah. Yeah. I start early. Low carb, keto.
Yeah.
Absolutely. Yeah.
Anti sugar club. Let's join me and Doctor.
Join. Join.
So
Annual
yeah,
payment. Free.
it's free. Does ginkgo really help to reduce dementia?
As a general rule, no. And specifically for some people, pretty good. I mean, there's no cure-all. Just like some medicines help one person a lot and another person not so much. Ginkgo and ginger and turkey tail and reishi and whatever it is, for some people it's a lock and a key, and it's like, this was a really great intervention. But on average, it might not show very much. So you just have to sort of experiment and see, does it help me as an individual?
Go back again. No sugar. You'll be fine. No
Yeah.
need ginkgo. Okay. Why does hearing loss makes dementia worse?
Loss of senses. You, it's isolation. It goes back to the social and community aspect that if you can't hear the people around you, then you're alone.
Yeah.
I spend a lot of time talking with patients, young and old, about the importance of all of their senses. That I'm really aggressive about sending people for hearing aids and vision testing. It's if you've ever lost your sense of smell, you'll know how depressing and disorienting it is. Yeah, so I mean, loss of hearing, this is nothing to be, people have pride. My father and grandfather's generation, they wouldn't want to have a hearing aid. It was, it was weak to have a hearing aid. I would love a hearing aid because if you gave me a hearing aid today and I could hear like everybody else, but it was technology, I want to hear better. I want my hearing aid to hear the secret conversations about stock tips in the corner of the restaurant. I want my hearing aid to translate Russian, right? That's what I need a Bahasa hearing aid. It's just going to translate everything I need. So I think it's very different when you don't think about hearing loss, but think about how technology can replace or augment our skills. That's really what I'm looking for, all jokes aside. Yeah.
Well, you can join the what do you call that? The Iron Man, the Aquaman, the
Uh-huh. Absolutely. Iron Man. Oh yeah. Uh-huh. And
what's
Luke
the
Skywalker, Star Wars, he lost his arm. Yeah, I'll take that.
that'd be
That's
cool.
fine. Yeah, that's
I think we're
fine.
gonna. Okay, it's already past 9. There was one last question, but we've
Oh,
discussed this earlier. But she wants to know, I guess, how does keto help dementia? Well, we'll repeat that.
so keto helps prevent dementia, and keto can help reverse the early stages of dementia or delay progression of dementia because the most common forms of dementia are strongly associated with diabetes and chronic inflammatory disease and insulin resistance. And the keto diet provides two major benefits in mental health, brain health dementia. One is it's the absence of the sugar that leads to insulin resistance. The second part is the brain prefers ketones as a fuel source. And when you're in keto or just chronically low carb, you're going to be in either a low or high level of what's called nutritional ketosis. And this is what we're trying to achieve. It makes your brain happy.
Yeah.
It helps your brain's immune system keep the brain clean. And this is the last thing. You have to think about your brain as like kind of a busy place. Like I'm going to say it's like think of it as like a college campus or, a university in some way. All day long, there's learning going on. And then at night, you have to clean up. Somebody's got to come clean the halls. And even before that, there's learning going on all day. And you have to remember things because there will be a test. So you have to file stuff away. But you have to be good at this because some things you file away to say, I'm going to need to know that tomorrow or next week. And some things you want to file away for long-term storage, but you want recall. And then there are things that are like, I don't need to remember, whether it's a negative item that I choose to, purge or, random conversations from a stranger on the train that I don't think are important right now. But at the end of the day, when you sleep, your brain is still highly functioning. And when you're on keto, the immune system is doing all that cleaning. It's doing all that pruning and keeping those connections that are in your brain sharp and fast so that when you wake up, you remember, why am I here? What am I doing? Where am I going today? Why am I doing it today? And how do I make plans so I can do it again tomorrow? That's the ambition. That's your knitting right there. Yeah. So yeah, keto helps for whoever asked.
Okay, I guess we need to wrap it up. It's 9:11.
9/11. We're going to wrap it up.
Wow, that time, that date.
What we'll have to take suggestions and find out what we do next month.
Yes, we have to. There's a lot.
Ice baths. I think we're going to have to go do some, we're going to have to talk about our experiences with ice bath and sound bath.
Okay.
Okay. All right.
Thank you so
Yanti.
much, Dr. Tucker. Thank you so much. It was very informational, and I think we did good on this topic.
It's always fun.
Thank you so much. It's always fun to have you around too.
I
Thank
love
you.
doing this. Okay. Bye-bye.
Good night.
Good night.